Greetings and welcome to In Depth. I'm Dike Rostant. International Day of Clean Air for Blue Skies was observed on September 7. Now, this makes 3 years of the observance. Quality and Health Advisor, WHO, Jose Castillo, he joins us to discuss the day itself as well as a project launched on that day. Mr. Lugo, how you do, sir?
Thank you, Dike. Doing very well. Thank you for having me today.
I'm very glad for us to have this conversation. So we start off, because we're going to focus a lot on the project, but in terms of giving the context, Clean Air for Blue Sky, what is the rationale of the day? Thank
you. I think that is a great question. Air pollution is one of the global threats to health. Nearly 7 million people die every year related to exposure to air pollution. So we have pollution from cars, from industry, and we also now have climate change exacerbating those issues. But that is not affecting just the environment, that is affecting people. So when people is very close to emission sources like vehicles, when they don't have clean energy at homes, they're exposed to these harmful pollutants that are affecting their health. So when we account for this as a global issue, we have 7 million people that die every year because of air pollution. So we want to understand what are the roots of that and also make a call to action so we can address and overcome this issue and have a more healthy society. So Clean Air for Blue Skies Days is about that. It's like that every one of us want to have a better world, want to have clean air, want to have the ability to see the blue skies. And I think for the Trinidad and Tobago and the Caribbean is also especially important because you guys have such a beautiful environment out there that we want to protect together.
And I like the fact that you talk about the general aspect and then you bring it back to the specific context, and looking at that specific context in Trinidad and Tobago, there, as opposed to just saying, okay, well, we're going to observe this, something launched. There's a roadmap that has been launched. So tell me a little bit about that roadmap, thanks.
Yeah, Nick, that's a great question again. So I want to start saying that Trinidad and Tobago is one of the regional champions on actions to protect public health from air pollution. The country has one of the largest air quality monitoring networks in the Caribbean, and further than that is implementing action to mitigate climate change, to reduce air pollution, and to protect public health. So this roadmap that we are launching during Clean Air for Blue Skies Days is an effort that the country is making to put together integrated action to mitigate the emissions from harmful pollutants through specific lines of actions in order to strengthen the regulation, the capacities of the stakeholders and authorities, and also to inform the public about the impacts of air pollution, as well as providing training to healthcare sector so we can have a better capacity to respond to this issue.
When you talk about the air quality monitoring network, what specifically is it monitoring for, or can you give us a general idea? Because I know different places may monitor for different things. So if there's a volcano on island, you may be monitoring for things like ash or certain gases that may be coming out of the volcano. So what specifically or generally, thanks?
Oh, so air pollution, it's a global issue, but what we understand for air pollution is the concentration of pollutants in the air. One of the most common pollutants and one of the most harmful pollutants is PM2.5, a particular matter under 2.5 micrometers. So it's very, very thin. But this PM2.5 can get into our lungs and also go to our bloodstream. So it causes it's very damaging for our health. Now, Trinidad and Tobago has an extensive air quality monitoring networks that monitor PM2.5, PM10, ozone, nitrogen dioxide, among other pollutants. Those pollutants are coming from different sources. So when we have combustions in our vehicles, so we have PM2.5. Actually, every time that we have combustion processes, we have PM2.5. So we are able to see that, the country is able to see that. But you also make a point about like this regional phenomena. If there is a volcano eruption, if there is Saharan dust. So the air quality monitoring network that Trinidad and Tobago has is able to identify pollutants from those regional phenomena, and it is being used to issue alerts to the population when there is a risk for health.
And looking at the fact that there is this monitoring network, the fact that someone who may want to be distributing grants, they say, okay, well, this country, it seems as though they're serious. They have these things already installed. What does that basically allow access to in terms of grants to really take the roadmap forward, the roadmap for air quality and air quality, climate change, and health?
Yeah. Why do we measure? So what is important to measure? So we want to understand the risk, but we also want to understand a way forward and be able to track our progress, right? So everything that we do have an effect in the air. Because if you wake up in the morning, or not you, but if someone wakes up in the morning and leave their car on, like all day, or it's going to make some pollution, right? But if there is some regulation that is saying, okay, we're going to have cleaner fuels, we're going to have electric vehicles, that is costly. But when we are able to monitor how this is changing air quality, we are also able to estimate the health impacts of that, on the health benefits of that. Actually, one of the key components of the project was to estimate the health co-benefits of improving air quality. And we ended up finding that we can reduce the mortality in the country, we can achieve economical savings by improving air quality. So now we are working with the Ministry of Health, the Environmental Management Authority, to prepare an updated air quality regulation for the country that help us to have more protective levels of air quality in the country. But further than that, because you guys have this strong monitoring network, we have the opportunity to couple to that like a epidemiological surveillance system. So we are able to see how the population is being affected by these pollutants in different areas of the country. This is part of the roadmap, and it is like a way forward as well. We are continually partnering with the Ministry of Health, Environmental Management Authority, identifying avenues to implement like those interventions.
Makes me also wonder what kind of CSOs or NGOs, people who are already on the ground trying to deal with environmental things, how they can reach out and be part of this. But even before you answer that, though, the launch and the health co-benefits of integrated air pollution and short-lived climate pollutants mitigations actions in Trinidad and Tobago. How long was that period of study?
Well, the project was developed between 2020 and 2022, like the most important technical component. That included like a consultation with different stakeholders, initially from the Ministry of Health, CSO, and regional health authorities, as well as EMA. And it was a technical process that included capacity building activities. We joint effort with the National Institute of Public Health of Mexico. Mexico used to be one of the most polluted cities Mexico City used to be one of the most polluted cities in the world. So they have invested also in improving air quality. So this project took a little bit over 2 years to be completed, but also builds upon previous efforts from Trinidad and Tobago, monitoring air quality, strengthening the capacity of the authorities. Actually, Trinidad and Tobago was the first country in hosting the celebration of the Clean Air for Blue Skies Days. And now this roadmap, 3 years ago was that. Now this roadmap also makes a look forward up to 10 years in the future as well.
And I want to get to that look ahead in terms of 10 years ahead. But just before we do that, and before we take the break, I want you to give us that example again and stretch it out a little bit, please, in terms of Mexico City being at one point in time the most polluted. Because sometimes people say, well, what difference can I make? I don't see the situation changing. So when you say most polluted, what do you mean? And what is the situation like now with the work that has been done?
Exactly. So Mexico City was known to be one of the most polluted cities in the world. So it even affected like air traffic. So sometimes airplanes couldn't land properly in the city because of the high levels of pollution. But also people was affected by that pollution. So when people in the past like landed to Mexico, they cried not because of the sentiment and emotion, but because of the pollution that was affected their eyes and their nostrils. Actually, this is 30 years ago. This is a story of the little birds dying in the street because of air pollution. So we have an issue with PM 2.5 and ozone. And it took the participation of many stakeholders to tackle that down, and the commitment of the health and environmental authorities. But I wanted to highlight also the importance of the participation of the civil society, the public, the civil society organizations and different stakeholders, because they say we want to live in a better city, and we all need to make changes in order to do that, and we all need to make commitments in order to do that. Nowadays, Mexico still have some issues with air pollution, but the decrease during the last 30 years has been dramatically. And now air quality is much better in Mexico. And not just that, but now Mexico is putting some of their experts out there, like trying to inspire action and provide technical tools around the region. I think that kind of leadership is being built in Trinidad and Tobago. Every person in the Ministry of Health, Environmental Management authorities has enormous technical capacities, but also a huge commitment in trying to make Trinidad and Tobago a better place every time. And also, I wanted to say this, Dike, is like, if you see the overall country, it looks well, like air quality is good, but also there are like certain hotspots when there is like high traffic areas where when you can feel that there is an issue with air pollution. So we also wanted to have a program, or the country has want to have a program that, yes, improve the overall approach, but also is making sure that the people who is more exposed can have a better life quality and reduce inequities.
And with that, we take a short break with Juan J. Castillo Lugo, the PAHO WHO Air Quality and Health Advisor. Stay with us, we'll return with more.
Trinidad and Tobago is an industrialized country with a growing economy, with high energy demands, increased domestic and industrial consumption, additional fossil fuel use for transportation, oil and gas exploration, and additional waste to be managed. These activities produce pollutants such as particulate matter 2.5, nitrogen dioxide, NO2, black carbon, methane, and other short-lived climate pollutants that contribute to the climate crisis. Such emissions impact the health of our population, exacerbating the risk of respiratory infections, strokes, heart disease, and lung cancer, resulting in increased medical expenses, hospitalizations, and decreased productivity. Air pollution is now the fourth leading risk factor for premature death worldwide. The Environmental Management Authority partnered with the Pan American Health Organization to estimate the burden of disease attributed to air pollution in Trinidad and Tobago. Using AirQ Plus, a software developed by the World Health Organization, and input data provided by the regional health authorities, Ministry of Health, and the Central Statistics Office, it was estimated that more than 600 deaths among persons over 30 years old were attributable to air pollution in 2019. It is time to act. Trinidad and Tobago is proposing an integrated roadmap on air quality, short-lived climate pollutants, and health. Prepared as a multi-stakeholders effort, the roadmap aims to foster a high level of political commitment, mobilize action on air quality, and the protection of the public's health from the effects of short-lived climate pollutants. Through 5 lines of action, the roadmap will address regulation and legislation, infrastructure and technological improvements, finance, awareness and capacity building, monitoring and evaluation. The goals are clear: enhance the health sector capacities in the air pollution-health relationship, review policies on energy, climate, transport, manufacturing, and agriculture, reduce the concentration of harmful air pollutants, foster the dissemination of collected data, and assist other Caribbean countries. It's in the air: saving health resources, a healthy, productive population, environmental sustainability. To save lives, it's in the air, in our air quality.
Welcome back. We are talking about air quality, getting blue skies or cleaner air for the benefit of all involved. We're doing so with advisor of air quality and health for PAHO WHO, Juan J. Castillo-Lugo. And a little before we took the break, there was something that you said in terms of that look ahead for 10 years. There was one thing to look ahead, but at the same time, what are some of those incremental steps that we need to take moving to that reality that we want to see? Is there anything following up on the project that's finished? What are some of those things that are taking place that we can look forward to?
Thank you, Dike. So the draft document has been finished, and now we are working like on the publication and engagement with different stakeholders to implement the plan. But in collaboration with the Ministry of Health and the Environmental Management Authority and the Pan American Health Organization, we have put together a following phase for this project that is going to be focused on two main aspects. One is to provide evidence to support the update of the air pollution rules. So WHO, the World Health Organization, updated the air quality guidelines a couple of years ago in 2021. Trinidad and Tobago has air pollution rules, if I'm not wrong, from 2017. And now the Environmental Management Authority has the intention to update those rules. But we are working with them to provide, and the Ministry of Health, to build the evidence to how what will be the health benefit, the health gains, how the population will benefit for having cleaner air in the country, and where is that population located. But not just that, but also what will be the most suitable interventions if we want to have like a better air in the country. So that is one of the components. We're going to build the evidence, conduct a health benefit assessment and a cost benefit assessment, and identify a portfolio of interventions that could be implemented in order to improve our quality. And that is like a national level. But the second part of the project that we are really excited about that is also an approach to healthy municipalities and working with the regional corporations in order to improve the quality of life also in the territory, like in the region. So how can we, if we are going to change the air quality regulations, that's fine, it's very important, but then this should also be manifested in the territory, meaning like we probably would like to have like more green urban areas in the cities. We probably want to have better transportation and increase active mobility and build an overall idea of healthy municipalities. So in this component of the projects, we are going to identify like a quick snapshot or what are the current impacts of environmental aspect in the cities and what are the best alternatives to move forward and what are possible the health benefits of that. So we are really excited about that because it's going to help us also for the country to work to strengthen the collaboration between the national and the national level and the regional corporations. So we're really thrilled about that coming soon.
I think that is something to be excited about, because the way that counselors should be a little more accessible to individuals, so also able to pass that information along if people have questions about it, and just looking at that rollout and that implementation. Because it's one thing to say, okay, well, yes, we have laws, or yes, we're changing the laws, but how do we implement, as opposed to just saying, okay, well, these things are there, they're on the books, but what do we do about them after? But also looking at those updates and the local input. Who are some of those stakeholders? Because yes, you've spoken about the Ministry of Health. Yes, you've spoken about the EMA. If there is a grouping that wants to become a part of it, saying that, okay, well, we're involved like in things like this in our neck of the woods, but we'd like to help implement, we'd like to help have a bigger impact because it affects us all. How do they reach out?
Yeah, I want to say that for the second phase of the project, we are partnering with Ministry of Health. We are supporting the work, Ministry of Health, Environmental Management Authority, Ministry of Planning, and also the Ministry of Rural Development and Local Governance. So, and we are currently on the phase of putting together the project to make sure that it's well articulated and all the stakeholders are participating on this. Now, in terms of how citizens can engage with this process, I would like to highlight that air quality data in the country is publicly available in EMA webpage, and also the Ministries of Health and Rural Development that are like very into listening the people and have like these mechanisms for participation. I would like to say that at this point, we're putting together the proposal to better understand how we are going to engage with the different stakeholders, but just to highlight that the information is publicly available, especially the air quality information, and I think that that will be something good to have a look. Currently, the weather apps in the cell phones, they used to have like some kind of air quality information that in the case of Trinidad and Tobago, because you guys have data, is like very accurate. It's very close to what is happening in the city, the countries.
All right, and last but not least, these things, they cost money. One of the things, well, not just money, but the resources. So are there individuals, are there groupings that have been targeted, or things already in place? Because I know that the country became a grant recipient of the Climate and Clean Air Coalition to advance effort to improve air quality. Are there any other people on the books or joining hands or ready to come on board?
Yeah, absolutely, absolutely. And I want to say that because of Trinidad and Tobago leadership and the effort that you guys have already implemented, the country become more attractive to receive granting, because donors, they don't want to waste their money, right? They want to see change, and they want to see like things are happening, and things are happening in Trinidad and Tobago. So we successfully closed this project with the Climate and Clean Air Coalition, and now we are partnering with the European Union and the EU CARIFORUM to implement phase 2 of the project. It's going to be probably a short time period project. It's going to last at least 1 year, but we are envisioning to keep looking for partnerships, to keep calling the attention. As you said it well, like we need to strengthen the capacities. Build. It's not just about like the funds, but also the resources and all that is needed. Also, we want to celebrate the leadership of EMA, Ministry of Health, and now Ministry of Rural Development and Local Governance, because they are aware of the need to strengthen the workforce, and they are investing also in their personnel. So I think it is a great opportunity to move forward.
And this is a great opportunity for us to put a pause on this conversation. We'll actually end with something from the EMA, Mr. Romano. But we want to thank you very much, Mr. Juan Jose Castillo Lugo, advisor on air quality and health for PAHO and WHO. And on behalf of the entire TTT News team, this has been In Depth with me, Dike Rostant. Thank you so much for joining us.
The main challenges for Trinidad and Tobago to achieve clean air is a combination of individual decisions where each of us need to do the right things, whether it is not burning garbage in our yards, whether it is investing in clean technology with respect to our vehicles, or servicing our vehicles to ensure that we do not produce fumes, negative fumes, which would impact all of us and the environment. And we also need policy decisions. Policy decisions such as the updating of the air pollution rules, which is the responsibility of the EMA. Legislation with respect to greenhouse gases, which we hoped to be completed early next year, where we're going to mandate companies to provide data on greenhouse gases. And really the opportunities are that there is so much good work being done by the Environmental Management Authority and other agencies to ensure that we have all the information, all the data to make good scientific decisions for Trinidad and Tobago.